Okay, hello.
Hey.
Hi.
So we
Okay.
have, yes, can you hear me?
We can hear you.
Well,
Okay, so we have Dr. Adam and Dr. Sam here. And why don't you introduce yourself and tell my followers and clients what you guys do?
Yeah, so we're Pelvis NYC. We're doctors of physical therapy that specialize in all things pelvic floor, and that encompasses everything pee, poop, and sex related. We see a lot of men here with erectile dysfunction, premature ejaculation. I'll let Sam talk about kind of women she sees.
yeah. So hi, I'm Dr. Sam, a pelvic floor therapist, orthopedist, and sport performance therapist. And I see women who are having pain with sex, as well as women that are postpartum and trying to get back into sport. So my blend is pelvic as well as sport based.
Okay, cool. So I asked my audience, or my followers, I told them about you guys, and they gave me, I compiled a list of questions that they want answers to.
Yeah.
Great, that'll be exciting.
Yeah. So the first one is, I'm going to read it off here. So somebody wrote, I'm a therapist working with a few clients at the moment who experience painful sex. Aside from a referral to a physical therapist, what other info resources can I offer them? What factors can be contributing that would be helpful to explore?
Yeah.
Shall I?
Yeah.
Okay. Yeah, so this is a great question. So I wanted to share a couple of online and self-help resources that I thought could be pretty valuable. And the first thing, outside of the pelvic floor therapy space, that I thought would be good for education were a couple of books that I had looked up for the audience, and they're really accessible in language and great self-help tools. So one of them that I had looked up was Come As You Are by Emily Nagoski. She's a PhD, and this is a great book that is used for reframing sexual response and normalizing variation of that. And it was at first published in, it's newish. It's published in 2014 and then republished in 2021. So that's a great source that I would encourage anybody to take a look at. And then the other book, actually, I had to plug a physical therapist who Heather Jeffcoat is a DPT, pelvic floor therapist as well, and has a book that she wrote, Sex Without Pain. And I looked at the front jacket, back jacket of this book, and it's targeted for women with pain. And I thought that would be really, really helpful because it's another self-help guide. And for women of all ages can walk through painful sex, different techniques to work on, and it has a perspective if you don't have a physical therapist near you, that can help guide, help you do a self-guide through, and all of it's written there. I thought those were two really great resources that I found, so I really like that.
Okay,
Yeah.
Sounds good. Let me know if did you want to say something, or should I go to the next
No,
question?
go ahead. You can continue. Go ahead.
Okay. So newly married, older, it doesn't specify an age.
Sure.
Husband has erectile dysfunction, never hard enough to penetrate, has taken I'm figuring it's Viagra.
Yeah.
Minimal effect. What would you suggest?
It's interesting. This is like I saw that question. It's a loaded answer. I'll tell you why. So when it comes to erection for men, there's different factors. It could be hormonal, right? Which in that regard, you'd want to get a blood test, check your hormones. You'd probably go to your urologist for that or your PCP. If it's psychogenic, so is he in his head before? I know there's even for the secular population that we treat, it's like guys nowadays have a lot going on in their head, and they're like, I have to stay hard, I have to get hard, I have to be hard before I start, and I have to continuously stay hard throughout like this whole process. And they think this whole process should be like 2 hours. So we mentioned hormonal, psychogenic, and then of course mechanical. So like that's where we come in. And so if you have tight muscles down there, the muscles allow for more rigidity of the penis. So if your muscles are tight, they don't work as efficient, and then you get erectile dysfunction. So even in the cases, most urologists would say, the ones that I spoke to at least, in the case where you're taking Viagra and it's not working, some guys think I took Viagra, therefore I should get an erection. And that's not how it works, right? You have to be actively aroused in order for that to happen, in order for the smooth muscle to kind of relax. And a lot of the times we talk about sympathetic and parasympathetic, all this means is like you need to be in a relaxed state to get an erection. And so even for medication to work, you need to make sure that you're properly aroused and you're into it. Otherwise, it's not going to work.
Okay.
So,
I think on an added note, you know, for couples and intimacy and aging, there is, for older couples, like we can like start even open the floor for talking about recalibrating what our sexual experience is. Because as we get older, you know, fluids are different, arousal times might be different, you know, so really having an open conversation with your partner, as well as if you have a healthcare professional, talking about what some of those challenges are, just to reset what you think it should be, because sex when you're 40, 50, 60 is not the same sex when you're a teenager, 20 and 30, and that's okay.
Yeah.
Just having that conversation, I think, can help too, aside from what Dr. Adam was talking about.
Also, is that coming from the partner, and does the partner have the expectation that their male partner has to be erect the second they start? Is foreplay a thing for them? I mean, there's so many
I
questions.
know, but also like it's hard for the partner because they feel rejected in a way. Like, why isn't my partner getting hard for me? Like, what is it about me, right? Like, what is it about me that they can't get hard? Like, what's going on?
And I think it's a huge misconception about erection and stuff is like, just because your partner's not getting hard has nothing to do with you. In fact, like in most cases, men find their partner really attractive, but they want to please their partner so much. There's like this undue pressure. And so then you add pressure. It's a head game, right? Yeah. Exactly. And you add this pressure to something that should be fun.
Yeah.
It takes the fun out of it, if that makes sense.
Yeah. The performance anxiety, right?
Exactly. That's the thing.
I totally get it. However, from the female perspective of like owning and taking on, like, what is it about me that is affecting your performance? And to that position, I really would say, take that burden like off your shoulders, you know, like let that go. Sex has, you know, it has function, you know, but it's making love too. I mean, it's about you and your partner. So as much as you want to give and receive, you know, just lay those burdens at the door, and you'll often find a more open experience.
For sure.
Yeah. Okay. I'm going to go to the next one. Do Kegels really help to get more tight? I think this is for Dr. Sam. More tight down there. Is there such a thing as too much Kegels?
Okay. Are Kegels great for making the pelvic floor tight? Absolutely. You know, like, but I would say, like using it for functional control, as opposed to just doing it to do it just to be tight. Because alternatively, like what you could get making your pelvic floor so tight is then what we call hypertonic. And that is like stiffness. And stiffness without control and being able to relax can lead to different complications. So I wouldn't make the aim of Kegels to be just to be tight and of your pelvic floor. So I would caution going crazy on it, but it is a very useful exercise that we use in PT all the time and prescribe for home.
Ultimately, the goal is just to build coordination and awareness with those muscles. So I'm guessing that, and by the way, the question is very relevant to men too, and I'll touch on that, but I'm guessing the relevance for most women is like maybe postpartum, and they're noticing that they aren't as tight down there, so they want to make sure that things may feel better during sex or maybe have more control. But ultimately, just building more awareness and coordination. And you don't necessarily do that by always going balls to the wall, so to speak, and just lifting the heaviest weight. Sometimes it's slow and steady. I'll touch up on the male thing because we do hear a lot about Kegels being more of like premature ejaculation and getting better erections. So just do 1,000 Kegels a day. That is one of the biggest misconceptions. And if we get anything from this recording, it's that is most men, like Sam said, most men tend to be on the tighter side. And so if you are constantly tightening with a Kegel, you need proper length and proper tension for a muscle to work well. If you're constantly tightening, then you don't have good length. You can't produce enough force. Why do you need force? Because when you ejaculate, you need that force to push through. Those are muscles that do that. So just do 1,000,000 Kegels. If there are men listening to me or women that have been telling their husbands or partners to do Kegels, don't just do that.
Okay. So Dr. Sam, how many Kegels or is it like?
Oh, you're asking me for
What do you
numbers.
think?
You're asking me for numbers and dosage. I don't like to recommend certain numbers because I do think that's kind of individualistic. But what I would say without giving a non-answer is maybe spend, let's say maybe 2 times a day and do it a couple of times a week. I really
Okay.
give a loose number because not everybody needs Kegels. So I don't want to say like, hey, just go out and do them as a, baseline exercise because it's not always your need. So I am going to be hush on that. Yeah, I'm going to be hush on that.
Yeah, I mean, ultimately, just get evaluated by a pelvic floor therapist or someone who understands. This way, they can see what your baseline is. It's the same way a doctor would prescribe medication. Technically, us telling you to do 5 sets of 40 reps or whatever means nothing because we don't know where your baseline is. And that's the most important thing, right? That's what we mean by patient-centered care.
Right. Okay. The next one I have, can smoking weed or eating edibles, whatever, which is THC, can cause erectile dysfunction? Can cause erectile dysfunction?
I don't know about that. I mean, look, can you get more in your head if you're high? Sure. Can you also not get more in your head and you're high? I mean, like, if I'm honest, like, if my wife's gonna watch this, like sometimes I have 3 kids, like it's nice to smoke a little weed and then potentially like forget about stuff for a little bit so that I can feel in the moment. So, but are there times where weed can cause you to overthink and has nothing to do with ED? Sure. And then you get erectile dysfunction? Do you then have erectile dysfunction? No, I think there's a certain portion of men that have difficulties with erections sometimes, and that's okay. That's usually an easy one, no?
Yeah, no, I would agree.
Yeah.
I don't think it has a causative factor, but
No research would show that.
no.
Yeah, there's no way.
Okay.
I'm a big fan.
Oh, same here.
Okay. Hi, my husband is 45. When we are together, he goes in hard and then claims he has anxiety and becomes soft. It can sometimes take 3 days till he tries again. He claims it's in his head. I think, is it really? Yeah, we discussed this previously about erectile dysfunction, that it can be in his head totally or not, but
this bleeds the question of like, so when I get patients in here, and like, by the way, majority of our patients that come to us for ED are ages 20 to 45. So like, this is very much a young man's issue. People assume that you have ED, you're like 85 and with a walker. It's not the case. So when I ask some of these dudes, I'm like, okay, so you were erect and then you got soft. And one of the questions I like to discern the difference between real ED and psychogenic is when you masturbate, what's your erection like? And they're like, oh, it's totally normal. And I'm like, okay, then might not have a problem. How much of like, first of all, are they communicating with their partner? Just telling them they have anxiety about what? What's going on? Why do you feel like you have to perform? I mean, this is a loaded question. You know what I mean? It's like,
yeah. And I know there was a study done that guys who watch porn a lot, excessively, have problems with erection. Have you
yeah,
heard of that?
yeah, of course.
I have, but you want to speak to that a little bit more?
Totally. So,
Because it could be the mechanics and the frequency.
okay, so the biggest problem I see with too much porn usage, by the way, porn has it's good. I think it eroticizes certain relationships, even maybe with yourself, whatever it may be, whatever that means to you. But I don't necessarily think porn is just another tool that to use, but where it gets bad is where you see a lot of these young guys and they're masturbating like 6, 7 times a day to something that's an inanimate object, so to speak. You know what I mean? So they're losing that also that real-time touch, like when they do insert it into a partner, it doesn't feel as good because they don't have the feedback from their hand that's going brain, hand, brain, hand. So you can squeeze this in a millisecond or whatever it may be, right?
Mhm. Yeah.
That's the biggest hurdle I see with porn. I don't necessarily think that porn is a bad thing, if that makes sense.
Yeah.
I talk about pornography too. I talk about pornography all the time, that it can be a good thing if you do it together, especially if it, it can enhance your sex life.
Sure.
But I'm thinking in regards to erectile dysfunction, and as you said, or they can use fleshlights, which is very different than their partner.
Mm-hmm. And that would probably be the closest to it, I believe. Like if you had to, because fleshlights, it's not your hand; it's still something else that you're inserting it into, if that makes sense.
Right? But it's right. They try to replicate a woman's vagina, but it's still something else.
Sure, it depends how you use it. I mean, if you're using it for a crutch, if you're using it because you're like, oh, nothing is bad. It's the same thing with diet. Like a donut is not bad. You could have a donut, but if
50 billion.
yeah, but if you eat a lot of donuts, like, or maybe balance it out. If you had a donut today, maybe have a salad for dinner. We need to simplify this stuff and just instead of just saying porn is bad,
Right.
jerking off is bad. That's not a bad thing, right? Like,
I agree.
it's the same way women should if a woman wants to masturbate, like that's her alone time. Let her do her thing. Doesn't mean that she doesn't want to be with her husband or her partner. Just let her do it.
I say that it can make her want to be with her partner after she masturbates, but that's a whole different subject. That's a different topic.
I think cycling just back to that client or viewer's question. One thing that I just wanted to touch on really was like kind of the cycle of it all. Like if she's wondering that it's in his head, like what is the cycle feedback that we're talking about here? Because if there's performance anxiety, and then that kind of links to a lost erection, and then that kind of links to avoidance, because she said it takes 3 days for us to try again, then we have an anxiety loop that's brewing here. And then there's going to be potential stress escalation, because now it's been 3 days and now I'm feeling some type of way about this and you're feeling some type of way about this. And then that can kind of cycle into that ED feedback anxiety loop, which many things can support, but a conversation about it. And, everything's okay. We're okay.
Yeah.
Our sex is good and can be so many different things, penetrative as well as other forms of sex that can bring pleasure too.
Right. I tell the women, embrace the flaccid penis. Just embrace it. Love it.
Absolutely.
Yeah. And then the guys were like, oh, okay. They feel accepted.
Yes.
And the pressure comes off and they,
Yeah.
Okay.
One thing I will say though, just to add that, because premature ejaculation is a real thing, right? I think 20 to 30% of the global male population have had or have at the current moment premature ejaculation. That's a lot of men. And that means finishing essentially before you would like to finish, and that can mean anywhere from 1 second to 3 minutes, whatever it may be. But what I found anecdotally with my men is that even if a guy feels like he's about to lose his erection, he will come quickly, because at least to him, he finished the deed, so to speak. Right? There was a beginning and an end. But if you lose your erection, that's like womp womp. It's like not as fun, and like you kind of like didn't finish. So at least you finished, and you didn't get the humiliation of what he would think losing an erection, if that makes sense.
Right. And then PE, this is my own personal question. Premature ejaculation can lead to erectile dysfunction, because you're so worried about that you're going to come quickly that you lose it, that you can't even perform.
And in this case, erectile dysfunction led to why am I blanking right now? An increased time to go back to sex. Refractory period.
Yeah.
Increased refractory period because he's avoiding it. So,
like not just the act refractory period, but the in the moment, but also the
3 days.
session.
The session. So all of this stuff could bleed into it, right? And it's not so black and white. Every situation is different.
Okay. Any way to heal a vaginal prolapse, and what's the best treatment plan for a woman in childbearing age?
Okay. I'm gonna give generalities for this because this question really is like a go see a pelvic therapist for this because it's very individualized. But from just for the edification of it all, a prolapse is a bulging of tissues and can be associated with a weakened pelvic floor. So going to a specialist that can help support the particular groups of exercises that you would benefit from for strengthening the pelvic floor is an avenue. Postural related exercises is also in concert with that is also an avenue to explore. And then anything that you'd want to add for that?
Yeah.
No, I think
Sounds good.
yeah, that's pretty it. It's if someone really did have that need, then you can, by all means, reach out to us, DM us, and we'd be happy to have a 15-minute consult to talk about that because it really is individualized. And it's the same way I wouldn't prescribe Kegels online. I wouldn't say these are the exercises that you need without knowing.
The question is, can it be healed? Yes.
Yes.
Do a lot of women go through it even in between like several births? Yes. Do they get better? Yes. What is like the gold standard for getting a prolapse better? Depending on what type of prolapse, of course, but generally like in your grade 1 and 2 is going to be pelvic floor therapy. They're really
Anything more significant, you would probably need an intervention from a physician or a surgical based.
For sure. We're really talking about the ones that are like just
in our lane.
prolapse. Yeah, correct. There are things that, of course, that are not within the scope of practice of pelvic floor physical therapy, but for the most part, that's the gold standard for prolapse.
Okay. I've done Kegels for premature ejaculation. We spoke about that, but then had split stream. I guess when peeing, doctors couldn't help. I read that this needs proper guidance from a pelvic floor therapist.
Hey. Okay, so why this happens. No one can really give you an exact answer why guys get a split stream, okay? But essentially the reason is there's a group of muscles, there's your pelvic floor, okay? Hold on 1 second. Let me just I'm gonna get you a diagram.
He's very thorough.
Okay.
Okay, ready? Ready.
Education time.
Okay, we're back. All right, so essentially this is your pelvic floor, okay? So this is the internal part of it. So my spine is right here. I don't know if you can see that.
I'll hold it for that.
This is the internal part, okay? But the external part is if I would be laying on the back here, my head would be here. I'm on my back. My legs are kind of in hook line position. Pretty much what I'm getting at is think of this part as your urethra. That's where urine comes out of. Can you see that?
Yes.
This muscle called the bulbospongiosus and the ischiocavernosal muscles, these muscles are in charge of letting go of that extra bit of urine after peeing and letting go of that ejaculate when you come, essentially, and also compressing the dorsal veins of the penis to increase rigidity during erection. So they're pretty important. What happens is this guy did so many Kegels that he's essentially like kinking the hose at which the volume of fluid comes out of. Does that make sense? And so you get a weird stream. So the best way to kind of make this better is just to reduce tone and relax the pelvic floor musculature. That's it. It's pretty simple, actually. But is there anything like anatomically wrong? In most cases, not, especially if it just started happening. Okay, you're not worried about what's called a urethral stricture or anything like that, especially if it just started happening after doing, I'm sure if he started doing Kegels, because most men, when they start doing something, they do it 100%. That's what's really cool about us men. The problem is it doesn't always work well, right? So
Yeah,
doing 1 million Kegels a day, or just we spoke about that. That's not really
right.
where you want to
That's
be.
not the move.
Right. I was thinking about something now after we finish it. I want to ask about squirting. I know we didn't discuss it, and I was wondering if it has anything, if you know about it, if it's the controversial question, is it pee or not?
It is
So
not.
I know it's not.
It's not.
I mean, based on my research, based on what I learned and what I experienced,
Mhm.
but the people want to know. So I'm going to get back to it. So I want to finish this first.
Go ahead, good.
As I get older, I don't get as hard as when I was younger. Anything to help with it, vitamins or natural diet, exercise, obviously,
Yeah.
but they
Uh,
want to be as hard as a 20-year-old.
it's so much easier when like the person's in front of you, you know, like if you have a guy with like a serious beer belly and he's like, you could tell he never exercises, he might smell like smoke. Like you have a good picture of like what his erections look like, you know? Um, Again, that being said, are the majority of men that we treat are 20 to 45 and healthy young men. They still have some sort of ED. Age-related ED is a thing. However, our lifestyle habits get crappier as we age. So is it just that, you know, the small arteries and veins just don't get as good? Does he have a heart condition? Is it psychogenic? Is it, I mean, this is a loaded question. We've probably gotten go over
Are there
it.
any vitamins you recommend that you believe in that work?
Vitamins. Some people talk about like L-citrulline, L-arginine. Again, out of our scope of practice, but I'm telling you like anecdotally, this is not medical advice, of course. Um, And then, of course, your Viagra and Cialis. What's good about those PD5 inhibitors, they relax smooth muscle. Cialis stays in your system for 36 hours. And it doesn't mean you're getting hard for 36 hours. You have to be aroused, of course. And Cialis is, I think, 15 to 40 minutes onset. So that's what I'd recommend if he's looking to get into it. But I mean, the best thing you could do is cardio. Like just start to get your heart rate up and start to get blood flow to the small parts of your body.
Mhm. Okay.
I'm not necessarily convinced that age-related ED is a real thing. I know the research shows that, but I've had a bunch of guys that are 70s and even 80s here, and they're just like, yeah, my erection's still good. I have never used any Cialis or Viagra, which by the way, when I was in school, I thought that was impossible. So
Okay, this is the last question here. It reads, can you please talk about vaginismus? Is there hope?
Yes, there is hope. What is vaginismus for those that don't know? It's involuntary muscle tightness, preventing penetration, and it could have a couple of reasons as to why that's happening. Some of them can be psychosocial related and trauma related. Some of them can be just hypertonicity, tightness of the pelvic floor. So there are a couple of different avenues that can help from a pelvic floor perspective, working on pelvic floor muscles and for relaxation purposes. We talked earlier in our segment about, you know, being tight and then knowing how to be able to relax those muscles. Working on that is one of the chief avenues on improving vaginismus. And go ahead, do you have anything that you want to add to that?
yeah, I mean, I just think as Sam mentioned, I mean, there's whether it's trauma related or whatever it may be, the goal within pelvic floor therapy sometimes is not necessarily just muscular, it's working on the nervous system. And how do we tone down like your nervous system response to things going on in that area, if that makes sense. So, you know, for women, it's penetration. For people who want to do, you know, rectal fun or anal, it's sometimes it's working on that, whatever it may be. But really, it's just toning down the nervous system response in that area, and that's really important. So, how do you do that? You have people on the table in pelvic floor therapy, and you do an internal, whether it be vaginal or rectal, and we teach them a series of breathing, and we try and get them to tone down the tone through breathing, and it's really effective.
Yeah.
Okay.
So
Can
I
we
think,
talk about squirting? Oh, you wanted to say something?
no, I'm just saying there's, of course, there's hope, you know, just because you've been to, and this really goes with anything, just because you've been to multiple doctors doesn't mean that A, they know everything, B, many doctors tend to gaslight and be very dismissive, especially in certain areas. And you believe it or not, sometimes you go to the big famous hospitals and you think I went to the experts and they couldn't help me, I'm screwed. It's not the case. There's usually always help, thank God, you know?
Mm, okay.
Yeah. Yeah. Squirting.
Um, yeah, yeah. What do you
Mhm.
know about it? And can it be, no, I'm just thinking out loud if it can be, is there such a thing as too much of it?
Okay,
Can
so
it be
squirting,
harmful?
no, it's not harmful. And it's very individualized across women. Some women experience squirting, some experience a trickle, and some might experience a lot. So it's really like analogous to female ejaculation. And it's the fluid that, and I can see why some people think that it might be pee because it expels through the urethra, but it's not. It comes from the skein gland. So it is a fluid that is separate from urine. Similarly to the way that males, when they ejaculate, their connection to the bladder is shut down so that ejaculate can come out. This similar process for women with squirting. But no, it's not harmful. Some couples find it fun. And honestly, your sex lives very individualized. Enjoy all of its facets, is what I say.
Okay. So the questions are done for now. Is there anything else you want to add that you think is important for my followers to know? I know you guys, you only see males, men, and are you only seeing women? Like, how does it?
So, so we've both treated both men and women. I went through a pelvic floor issue myself, and I found that I was treated by women and some that really understood what they were doing, but there was a disconnect there, right? I'm a male with a certain appendage, and I mean, I cannot really fully understand what goes on in a vagina. I don't have one, right? So
Yeah.
I think it's better if people get same gender care. It's just easier that way. But if, of course, if nobody minds, then yeah, of course we'll treat them. I just think it's
Okay.
easier that way.
My perspective is this. I think we want all of our patients to feel comfortable, period.
Yeah.
I advocate for the care of, anyone that wants to be cared for by me. So I'm happy to care for males. I'm happy to care for females. And I think in this practice environment, we champion making sure that all of our clients and patients are comfortable. And so if that means a male wants to be seen by our male team, then absolutely. But and some males might not be comfortable being
Right.
seen by men. And
True.
I'm happy to support their needs because every care is individualized. Your needs are your own. And every time you come in to see one of us, we listen. We're here for you. We advocate for you, and we search for answers for you.
And this is all just a quality of life issue. So like myself, Dr. Sam, and there's another great PT in our practice, Dr. Josh. This is all just a quality of life issue. So whether it's sex or bladder and bowel dysfunction, whatever it may be, we just want to help you get better. And that's the most important thing. I think there's a lot of stigma associated with all of the above. And I tell my patients, like, tell me anything and everything. Because whatever, the more you tell me, the more I can help you.
Nothing is off the table. Nothing is taboo. We want to hear you, and you can share anything that you need so that we can help you get better.
Yeah, I think,
Yeah.
what was it, like 6 months ago, I found out what sounding was. I didn't know what that was. Have you ever heard of that?
Sounding?
Sounding? No?
Go ahead.
It's essentially where males put rods in their urethra while erect.
No, but I don't know what the name of it.
Yeah, so I didn't, so again, I'm still learning as we go, sometimes, but this patient wasn't met with shame or anything. I was just like, okay, we just have to figure out how to work around that or get you better. But everything and anything, I mean, we just want to help you with whatever it is. It's all a quality of life issue. It's the most important part to being here. Yeah.
Okay, thank you so much for joining. These are very, very important topics. So I'm glad we spoke about it. And yeah, thank you. I'll speak to you anytime.
Thanks for having us.
All right. Bye now.